Welcome and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'll be your moderator for today's Faculty and Research Town Hall. Begun fall quarter 2021, and once again, we've brought together a group of panelists today to provide you updates on the continuing evolution of our operations during the COVID-19 pandemic and to answer your questions. Some questions were submitted during registration, but please feel free to use the Q&A window to submit additional questions for our panelists. Due to our time limitations, we will not be able to get to all of your questions, but we will log the questions as they come in and post answers on the Return to Learn website with the link pasted into the chat. Today's webinar has live closed captioning available in two ways. First, you can click on the closed caption button at the bottom of the screen and select Show Subtitles, or you can also click on the link that is being pasted into the chat. Well, now to start things off, I'd like to go ahead and introduce the host of today's town hall, Executive Vice Chancellor Elizabeth Simmons, for some welcoming remarks. EVC Simmons.
Thank you, Senior AVC Continetti. It's a real pleasure to co-host this town hall today with Vice Chancellor Brown and welcome everybody to the 2021-22 academic year. It's wonderful to see our students back in person in such numbers throughout the campus and to see them responsibly wearing masks even outdoors and following all the safety protocols. Our live convocation ceremony last week was a joy, and we're grateful for all the faculty who were able to attend and take part. And even today, as we enjoy a rare misty rainfall here in La Jolla, the line outside the new Target store on campus remains enthusiastically long as students avail themselves of our newest campus facilities. So today's town hall, we will be reviewing the latest developments to campus operations, including updates related to the vaccine mandate, instruction, and research. But before we begin, I would like to take the opportunity to again thank all of our faculty colleagues for their ongoing flexibility, understanding, and support of their fellow Tritons. To be truly student-centered, research-focused, and student and service-oriented, we have to work together collectively and coherently to empower each member of our UC San Diego community to succeed. And that's what I see each of you doing every day, and I'm very grateful for it. Now, please know that we have many resources and services available to assist you with the transition back to in-person instruction. And in particular, the Teaching and Learning Commons has revamped its keepteaching.ucsd.edu website to include specific information on pandemic resilient teaching. The Educational Technology Services Office has similarly updated edtech.ucsd.edu to better assist you. Well, we have several presentations today, and I know that our panelists will look forward to answering many of the questions that participants have submitted in advance. I also invite you to review the messages that were emailed to you last week that contain links to helpful information about fall instruction resources. And also, as always, please visit returntolearn.ucsd.edu on a routine basis for the latest updates and detailed answers to frequently asked questions. Again, welcome. So glad you're with us today. Back to you, Senior AVC Continetti.
Well, thank you, EVC Simmons. Now I am pleased to introduce Senate Chair Tara Javidi.
Hello, everyone. My name is Tara Javidi. I'm the incoming chair of the UCSD division of the Academic Senate for this year. This is not Senate's show, and there's a full program, so I'll be extremely brief. Firstly, I want to somberly welcome all of my colleagues and cautiously celebrate our return to campus after 18 challenging months through a global pandemic. I want to take this time to acknowledge that in a variety and unfortunately quite inequitable ways, the pandemic has affected our community in permanent ways. We have lost colleagues. Many colleagues have been grieving the loss of loved ones across the globe, and many are still struggling with serious challenges around health, family, and work-life balance. So here I would like us all to be celebratory, yet patient with ourselves and compassionate with our community as we all strive to push through what hopefully will be the transition back. I would like to take this time to remind my faculty colleagues that we all can and must be active participants in shared governance of our university through the Academic Senate. You can learn about specific Senate initiatives and positions on our website. However, let me just take this time to report on my very first system-wide academic council meeting last week. UCSD faculty and the academic senates are really ahead of other divisions. Senate members have effectively partnered with EVC and the Chancellor to ensure a safer return to campus, to direct our research, to address timely needs, and to equitably address professional impacts of COVID on our colleagues. UCSD division of the Academic Senate has also been leading in empowering and recognizing faculty, researchers, and instructors for their tremendous resilience, creativity, and flexibility in terms of teaching, content, modality, assessment, community service, and also research in terms of productivity, impact, and resilience. To further strengthen this tradition, however, I would like to ask all of you to be more engaged with the Academic Senate. While it seems extremely hopeful and upbeat to be transitioning back, there are formidable challenges ahead. In addition to the Representative Assembly, we have 26 standing committees who work tirelessly on all of our behalves, on all aspects of governance. Please do take a few minutes to familiarize yourself on our website with these committees, their members, and your representatives. We really need everyone's wisdom and participation to engage with our colleagues on the administrative side. Please stay in touch and stay engaged. Back to you, ABC Continenti.
Well, thank you, Chair Javidi. Now I would like to move on and introduce our first presenter today, Executive Director Josh Kavanaugh, who's going to update us on the exciting advent of the light rail connection to the UC San Diego campus this fall.
Wonderful. Thank you so much, ABC Continenti. So it is truly exciting to be welcoming our colleagues at SANDAG and MTS to the campus with this incredible piece of infrastructure, and then to really welcome our fellow Southern Californians to the campus. I want to anchor what we're doing with light rail in the context of the campus transformation, though, because it is both a manifestation of and a catalyst for the campus transportation. So in the campus strategic plan, we talked about the idea that the transformation should enhance campus as a destination. It should enrich the student experience. It should spark research and innovation. And as a practitioner, we really translate these into the themes that you see on the screen. The idea that we should activate and enliven the campus. Create great spaces for our incredible people, that we need a healthy and sustainable campus. And boy, in the last year and a half, have we experienced the importance of that and the importance of our open spaces more than ever before. And then really that we strengthen our programmatic relationships, that we create collaborative spaces and we find new ways to work together, that we encourage that collaboration and innovation for which UC San Diego is known. Next slide, please. So to put this in perspective, I wanted to share a recent event that Campus Planning and Transportation were honored to be able to host together with our colleagues in Student Affairs. This is part of TWOW, or the Triton Weeks of Welcome, and it's an intervention that was done at the lawn on Rupertus. And it is born out of a design-a-thon a year and change ago. So student-initiated ideas and student-executed ideas. And as we look at what students are doing in here and creating a vibrant outdoor space, we are truly activating and enlivening the campus. We are creating healthy and sustainable spaces that people can enjoy together, even during these times where we're concerned on occasion about being close together or in groups. And we're strengthening programmatic relationships. We're finding ways to work across the historic silos of the university, again, with very operational units, collaborating with student affairs and the facilities arm of the university. Next slide, please. So let's take a look at how the campus transformation and the arrival of the UC San Diego Blue Line trolley are reshaping the University Center. And Max, can you roll the film? So you see the I-5 overcrossing there, and we're coming in on the light rail over that beautiful new park that we'll be constructing over the next year or so. Camp Snoopy on the left and Pepper Canyon Housing East on the right. Here we are arriving at the Central Campus Station, that beautiful new design innovation building on our right. Concordance, the Ann Hamilton piece in the basalt there flowing up Rupertus Way. And here we have the Epstein family amphitheater. First concrete pours for the bowl there happening last week. It was truly exciting. We've also started to lay the basalt pavers for Concordance now. So really excited about that. Rupertus Way, unfortunately, is not going to be fully open at light rail. We'll be bringing pedestrians around and up in on Matthews Lane, but the full Ann Hamilton piece will be installed by the end of spring quarter, and we look forward to having that new incredible pedestrian connection through to University Center. So, UC San Diego is going to have two stations, the Central Campus Station and La Jolla Health Station. We're working on the final train schedule, or more precisely, MTS is doing that, but we open the trolley, first rider, November 21st, and we're expecting 15-minute service on the light rail trolley between 8 a.m. and 5 p.m. I'm sorry, between 5 a.m. and 12 a.m. Bidirectional service every 15 minutes. And if you're on campus now, as many of us are, you're going to see those tester trolleys running back and forth as they train additional operators and make sure that everything is ready for us to welcome the community. So we've got a lot going on, though. We talked about the arrival of light rail, both as a manifestation of the campus transformation and as a catalyst for it. And so Innovation Lane, formerly Pepper Canyon Lane, where the buses come in, as I get particularly excited about, to pick up and drop off people going back and forth to trolley. We are wrapping up work there now, and we'll be ready for first rider. And in fact, our buses are already using it today. The renovation of campus, or of Pepper Canyon, is going to be ongoing into January of 2022. And we've got a great new bicycle and pedestrian connection coming in on the east rim of the canyon there, which we are pushing hard to try to get completed for first rider. Rupertus Way opening again at the end of winter quarter in time for spring quarter, and then the Epstein family amphitheater scheduled for completion this coming summer. And what a great way to welcome our students back for fall quarter of 2022. Next slide, please. So finally, talking about some of the, or not quite finally, but next talking about wayfinding. And obviously, as we welcome a whole new population to campus, we need to continue to turn up the volume on wayfinding and find ways that we can help folks that are new to campus or even have been here for a while navigate our changing campus. And so we're taking advantage of all these wonderful vertical spaces with our construction fences and adding graphic signage that will help provide interpretation about the projects that are going on and also support wayfinding. MTS is bringing their standard signage package to all the light rail stations, which incorporates real-time light rail arrival information. But we're UC San Diego. We do things one better. And so the digital wayfinding kiosks, like you see on the right side of the screen here, we're installing that at the bus stop at the Central Campus Station, and actually at a number of locations throughout campus. And not only will these provide wayfinding information, but if we were to scroll through the multiple screens that these cycle through, you would see real-time information for campus shuttle arrivals and MTS bus arrivals as well. So we're upgrading the pedestrian and vehicular wayfinding signs around the central campus. And below you'll see illustrations of a project that I'm particularly excited about. And one of our great student interns, Tommy Young, they're giving us a demonstration. The Waypoints project installed QR codes on light poles throughout the campus, about 250 of them. And if you were to scan any of those with your smart device, it will open up the campus map, center it on the location where you are on campus so you can anchor yourself in the campus context. and then open a dialogue that shows you where you can find food around you, what campus services are available around you, the transportation options, of course, and even our public art that's available around that very spot where you are on the campus. Next slide, please. So finally, a few transportation things I can't not talk about that. At that central campus station, we will have our campus shuttles operating. Both loop shuttles, the inside loop and the outside loop, will be operating there starting November 21st with 15-minute service. And so every train, we will have shuttles there to meet it and take you in either direction. So we're constructing a new turnaround on Russell Lane right now. That will open up in about a month and provide Lyft and Uber private party drop-off for folks that are getting to the light rail station or accessing University Center. And that's really to support the pedestrianization of University Center and make sure that as we see more people coming back and forth on Rupertus, that we don't have a whole bunch of vehicles crossing that and creating an unsafe environment. And then, of course, lots of improvements that we're doing along Voight to provide better pedestrian and bicycle environment, and also upgrade lighting and aesthetics. For the very first time, we're going to have protected bikeways crossing the Voight Bridge. And that, again, will be in place for First Rider November 21st. And that's my time, folks. AVC. Oh, one more thing I can't forget, safety and security. I'm so sorry. But it is absolutely huge. And I want to acknowledge Acting Chief Murphy, who's been incredibly active in conversations with the MTS security arm since he rejoined us on the campus. We've got security cameras that are in place at the station, monitored by both MTS and UC San Diego. The gates at the stations will close when trains are not running overnight. So we make sure that none of our adventurous community members find themselves up there and on the platform or on the tracks when trains are not running. The MTS security team is assigned to the campus and the UTC stations. So they will have a presence. There is an MTS security officer who will actually be on board riding random trains back and forth between campus and UTC. So UCPD, again, with that collaboration that we were discussing earlier, will be able to respond to law enforcement needs that are called into the dispatch center. And then that real-time communication between UC San Diego and MTS police is going to be fundamental to making this work for all members of the community. And that is just the beginning of that ongoing collaboration that Chief Murphy and his counterpart at MTS have in place. And now for real, Bob, back to you.
Well, thank you, Executive Director Kavanaugh. Those are very important updates for our return to more in-person activities. And as someone who's been on campus for many years, I'm particularly excited about the fact that the light rail is coming this fall. Now we're going to move on to hear from Dr. Chip Schooley, Professor of Medicine, on the current state of the COVID-19 pandemic. Dr. Schooley.
Thanks very much, Bob. I'll be relatively brief about the state of the pandemic, because I think most of us are well aware that we're beginning to see a fairly clear downturn in the most recent surge of infections, which was driven by the Delta variant. Virtually everything we have in the US these days is a Delta variant virus that took off in early summer as we were coming out of the spring surge. This was driven by a variant that was much more transmissible and much more capable of causing severe disease in those who were susceptible. Things are better in the US, next slide, and also better in California. You can see California had not quite as big a surge as much of the US, and we did much better than most of the other states, as you can see above us in terms of cases per capita. We're continuing to come down, particularly along the coast. Next. Across the UC San Diego and in San Diego in general, the number of cases on the upper left panel are declining over the course of the last several weeks in conjunction with the California cases. The number of hospitalizations in San Diego County is going down. So again, we're seeing morbidity and mortality declining with new case numbers. Next slide. In terms of the testing on campus, we've had a big surge of student tests, as you can see in the left lower panel, as students have come into campus, thanks to all of the hard work of Dr. Sosha and her team at Student Health and housing and dining, we now have over 12,000 students happily situated on campus, with only about 0.1% of the incoming students coming with SARS-CoV infection, which is quite a bit lower than we were expecting, and quite a positive finding, showing the students are really taking this very seriously. In terms of new cases, we're having a handful of new cases a day, which is what was seen at Berkeley and at Merced after the move-in, but we're starting from a very low level, and I think we're doing quite well. On campus, our campus employees, as you can see on the right panel, 3 to occasionally as many as 6 cases a day, but still quite quiet in the overall scheme of things. Next slide. Now, with respect to vaccination, you can see San Diego is one of the more vaccinated cities in the country. We've reached almost 90% of people above the age of 12 have had at least their first vaccination. And the big spread there, this 10% spread, shows you that many people started recently on their vaccinations. On campus, you'll hear more about this from Dr. Sosha. We know that at least 91% of our students are coming in vaccinated. As numbers get collated and things are tuned up, we think we'll be doing even better than that. With respect to our campus and health employees, you can see both are above 90% now and are doing well as we approach the deadlines for the state mandate. Next slide. Now, what about booster shots? So what are we seeing now? What we're continuing to see is that each of the 3 vaccines that are out there are doing quite well in terms of preventing people from being in the hospital or dying. But we're seeing an increasing number of breakthrough cases. To illustrate that, in the at UCSD this morning, we had 54 people in the hospital. 46 of them were people who had not been vaccinated. 8 had been vaccinated. Of those who were in the ICU, however, all 10 of them were people who were unvaccinated. So we're seeing occasional breakthrough infections that are severe enough to be in the hospital, but these are often in people who are otherwise at significant risk for COVID, very old or have underlying conditions, as opposed to people, adults who are otherwise healthy. The breakthrough infections are generally associated with mild symptoms or no symptoms. They can easily be mistaken for flu. So if you start feeling like you've got a cold or some allergies and you haven't had them, it's certainly a cue to get tested for COVID. As I mentioned, people at higher risk, though, can have significant disease with these breakthrough infections. As we've seen on our campus, the best levels of protection are being seen right now with those who received the Moderna vaccine, followed by the Pfizer vaccine, and followed by the Johnson & Johnson vaccine, but overall still doing quite well. What would be the boosters? What would be the point of the boosters? This was a point of discussion last week at the CDC and FDA. Most of the time we give vaccines to prevent people from getting sick. In this case, that would definitely be a reason to do it in people who are in this group who are getting severely ill with the breakthrough infections. But we also are doing it to try to decrease the rate of ongoing transmission, to decrease morbidity and mortality from those who can't be vaccinated, i.e. those children or people who can be vaccinated but not respond, immunocompromised patients. Next slide. In terms of the vaccination schedules, you may remember that the Pfizer vaccine was given at week 0 and week 3, Moderna vaccine week 0 and 4. The Johnson & Johnson was so far a one-time vaccine. We think each of these is going to basically require one more vaccination further out from the initial vaccine or vaccine series to be more consistent with other vaccines we've used in the past and to get us up to levels of immunity that will be more durable and stronger. So all of these are being called booster shots. One could really argue these are more like the 3rd vaccination that is in the series that we give with most other vaccines that we're used to giving. Next slide. In terms of the discussions last week for the Pfizer vaccine, the one that is getting the most discussion now because it was the one first out the door and for which there's best evidence of immunity declining. The FDA received an application from Pfizer in the summer to offer booster vaccines. The FDA's Center for Biologics Evaluation and Research, CBER, reviewed this and then asked its external advisory panel to consider whether the vaccine should be offered. And the FDA modified Pfizer's response or request and suggested that it should be made available to people over the age of 65 those underlying conditions, or those in frontline conditions that would put them or people they're in contact with at greater risk of infection. In other words, healthcare workers and those in teaching K through 12. The CDC then is the next step in this. They last week took this recommendation. They have a committee very much like VRPAC, the ACIP. They obsessed about it on Thursday and Friday and came back with a recommendation, or Wednesday and Thursday, and came back with a recommendation that the vaccine only be made available to those over 65 with those underlying conditions, but not to those frontline people that I mentioned earlier. The CDC director overruled them, and the federal approval is headed toward those over the age of 65, those underlying conditions, and those who are at risk for themselves or others that they are in contact with, being eligible for vaccination with a Pfizer booster, those who started with Pfizer. Next and final slide. Now, that's the Pfizer schedule. You can see on the top line, beyond the most recent discussion I had, 924, Pfizer has the data for children 5 through 11 already at the FDA under consideration. And it's anticipated that some decision will be made about that booster shot, or about initial vaccination for children 5 to 11 between now and the end of next month. Booster shots for the general population, harder to tell, but sometime likely in November or December. And younger children, ages 2 to 5, are currently enrolled in clinical trials. And we should have data for them toward the end of the year. Moderna has now filed for booster shots for people analogous to the ones we discussed for the Pfizer vaccine. I imagine we'll hear about them next month sometime. Their pediatric data starting 12 through 18 will follow shortly thereafter. Johnson & Johnson has also submitted booster vaccination data, and we'll likely be hearing about that sometime toward the end of October or early November. So the short answer is most of us are headed for recommendations for booster shots with a timeline that will likely roll out over the course of the next several months. Thanks very much. I'll turn it back over to Javidi Continetti.
Thank you, Dr. Schooley. Now we're going to move on to hear an update on compliance with the University of California vaccine mandate and other aspects of COVID safety from Dr. Angela Shosha, Interim Executive Director of Student Health and Wellbeing, and the Chair of the Vaccination Mandate Work Group, and she'll be joined by Terry Winbush, Senior Director of Labor Relations and Employee Relations.
Hi, good afternoon. Certainly there's been quite a bit of activity this summer, and we've been updating our policies to reflect those things. I'm going to go through a number of things, starting with the mandate, but also cover a lot of the campus safety precautions that we have in place. Remember, the mandate is to be fully vaccinated or an approved exemption. You saw the numbers. We're doing fairly well. There are some challenges, though, and why are we not at 100%? Part of it is data challenges, making sure we have the right denominator. Our student enrollment keeps changing as it's expanded a little bit and they convert to fully enrolled students. We also have students who have WHO approved vaccines that have to be manually double checked, and there are some challenges with that as well. We've had some employees who've not checked the consent box. So there's a lot of work going on to bring that number up to the 100% within short order, that you will either be fully vaccinated or you will have an approved exemption. Next slide. Now, those individuals who do have approved exemptions or deferrals for pregnancy need to follow non-pharmaceutical interventions. And we'll be talking quite a bit about this. These are going to be defined by each of the campuses in the UC system. They generally will reflect masking as well as COVID testing requirements. And I will be addressing exactly what those requirements are. And there will be some unique requirements for those individuals who are unvaccinated. Then there will be some that apply to everybody. We're quite encouraged that a number of our students who are partially vaccinated over the summer and did not have access to full vaccination, particularly our international students, have been availing themselves of vaccination since arriving on campus. We continue to offer vaccination at the Price Center, both for students as well as employees, a couple days a week, and there's a schedule. You do need an appointment. People are wondering a little bit about flu vaccine. Right now, we do not yet have the official policy, but it's likely that there will be a mandate with attestation. More will be coming out, but please take advantage of flu vaccines. They're widely available in the health system drive-up sites. They're also available at many pharmacies. With your insurance, you should have no problem getting flu vaccine if you'd like to have it. We don't yet have it available at the Price Center. We're working towards that, so that we hope to offer that for employees later in October. But you don't need to hesitate. Please take advantage of flu shots. Next slide. Okay, so there are some changes about exposure, and this is important to keep in mind. We have a great system with the UC San Diego Public Health team and our student health team that does case investigations for our employees and our students, as well as contact tracing. So that system is intact and continues to do quite well with a rapid identification of any positives that are identified, as well as the contact tracing for exposures. Things have changed now in what is allowed for individuals who are exposed if they're vaccinated. If you're not vaccinated, you're someone who is not 2 weeks out from the final series, or is someone who has an exemption or a deferral, you're not able to be on campus once you've been exposed. With Delta, we know of the high transmissibility. So you need to remain in place. You are to quarantine. The period has been changed though with Delta. It's now a 7-day period in which you need to monitor symptoms, do the daily screener. As soon as you're notified that you've been exposed, we recommend a test promptly, and then to get a day 5 post-exposure test. If at the end of 7 days with a negative day 5 test, then you're considered out of quarantine. One of the big changes now is that the vaccinated community may now work. This is a change in Cal OSHA. If you remember last summer and spring, it was healthcare workers who were vaccinated were able to continue to work. This has now been expanded to all employees. If you've been vaccinated and there is an exposure, you are allowed to come and continue to work. We have added an extra safety precaution though, and that you will need to mask not only indoors, which is the current requirement for all of us, but also masking outdoors. Basically, you'll be masking in all spaces, including indoor offices, all indoor spaces and outdoor spaces when you're on campus. And we ask that you eat alone, not with others. Students who are residential students who have roommates will be moved to quarantine housing, even if they're vaccinated. The unvaccinated students also will be moving to quarantine housing. There is a subtle change in that while the period is 7 days for quarantine for most things, for employment, it actually lasts for 10 days. So it's very important that you actually monitor for symptoms for 10 days. Unvaccinated employees actually can't return to work for the 10-day period. So there is a longer period for employment exposure activities than for other activities on campus. Again, the vaccinated community should also do the testing upon notification in day 5. That is the same for both communities. Next slide. Masking. So masking, regardless of vaccination, is required in indoor spaces with no eating or drinking. Please go outside for this. I know that's a little bit tough, and we've been asked about this in terms of the reacher space or others. Unless you are in an enclosed personal office or an office, you're the only individual within that office, then there is no eating or drinking, and you are to remain masked. Outdoors, we are exposed, vaccinated employees and students should mask, and we encourage masking in crowded situations. For our students living on campus, they are continuing in phase 1. They are masking in the common areas, with the only difference being that they do not need to mask in their personal bedroom or in the shower. Next slide. So the testing, unvaccinated individuals for their surveillance need to test twice a week. That should be no less than 3 days and no more than 5 days apart. This is a requirement now, and it will be tracked both for students and for employees. Failure to follow surveillance testing will result in red thumbs and not being able to be at work. You also need to test if you have the new onset of symptoms, and for wastewater signals for our residential students. This will be both for the vaccinated and the unvaccinated. For others, if you see a wastewater signal in the building you're working or learning in, please we encourage you to test. Unvaccinated, again, exposure upon notification in day 5. For the vaccinated community, there will be 4 weeks for students only of required weekly testing, not twice a week, but once a week, just the first 4 weeks while we assess everything. Employees are encouraged to take advantage of weekly testing, even if you're vaccinated. Testing for vaccinated individuals is the same if you have new onset of symptoms. Similarly, if you have a wastewater as a residential student or you're working in a building in which there's a targeted message, and the exposure is exactly the same, whether you're vaccinated or not vaccinated. You should test with the same cycle. Next slide. We are modifying the daily symptom screener to make this a little bit easier for you. We are going to bring together information when you do your daily screener about new onset of symptoms and exposure. We'll also be looking at your vaccination status behind the scenes and your compliance with the required twice weekly testing for the unvaccinated community. We'll pull all of that together and simplify it with 3 symbols. A green thumb will indicate that you're great to come onto campus. You can participate or come under the health system. A yellow thumb will mean that you have an exposure, but you're allowed to be on campus, but you must be masked at all times, and you should not eat with others. A red thumb will indicate, for a variety of reasons, that you're not to be on campus or on the health system as well. One of the things that's nice is we've been able to harmonize, and everything for health system employees, campus employees, and students, basically all the requirements are lining up and they're the same for all of us. So this should make things easier. We've built some tools for managers, and Terry will be discussing a little bit more about the management tools with testing. We have similar management tools for our students for compliance with the testing. Next slide. So I want to remind everybody that you can go to the RTL site and get the latest information about where we are seeing wastewater signals. So please take a peek, make it a habit to look where your building is and check every day. Next slide. We have the vending machines. They are up and running. We have 20 sites now, including the drive up. Now there's a drive up at Osler, and then we will have a second drive up on Torrey Pines, and that should be up and running by the end of the week. So the kits are available for employees and students. Employees have to have a first test at the Price Center or health system. After that, they can use the vending machines. We are able to let students start right off with the vending machines. It has to do with the way your charts are created to track all the information. These kits include instructions, a swab, and the testing vial. It's very important that you actually identify your test vial, your sample, and that's done through a barcode, which is captured through the UCSD app using your AD logon. Capturing this app, the actual identification barcode, is critical to know that that test result belongs to you. The results will be available within 24 to 36 hours in your My Chart or My Student Chart, so you'll have results immediately. If by chance you don't see a result after 24 hours, we actually encourage you to retest. Every once in a while, someone hasn't captured the barcode, or there's something unusual with the sample, or it's an invalid. We've seen folks inadvertently turn the swabs in upside down, or we found out sometimes they haven't tightened the vial cap and it's leaked. And so the sample can't be run. So if you don't get a result and you've done a test within 24 hours, just retest, keep an eye on it. You should get a test result soon after, a second or the first time in case it's delayed. Next slide. Okay, just a reminder, you do need the UCSD app to use the testing machines. Make sure you click on the scan now, capture the barcode, confirm it's been captured. And please don't use your credentials to test for someone else. We've seen this. It's well intended to do it for a family member or friend because they don't have access to testing, but that's a form of medical fraud, and we have no ability to actually be sure that it really belongs to someone else. So only use your test for yourself. Next slide. Okay, and I just want to remind everybody to take advantage of the Cal Notify app. This is another tool that uses Bluetooth technology to indicate individuals who've been within proximity for 15 minutes, in close proximity to meet an exposure notification. And you'll be notified sometimes before the contact tracers can reach you. So this is a nice tool to have in place. Next slide. And now I'm going to turn over to Terry to talk a little bit more about the employee process.
Thank you, Angela. So just a quick update on the return to campus efforts and all things related to COVID-19 and employees. The Office of the President did extend the emergency paid sick leave through June 30th, 2022. So that did not change the allotment of the 80 hours, but it did change when that expires. So if you have not used it and you need to access it at some point after September 30th, you now have until June 30th. You also have that same time frame if you are a policy covered employee and you have vacation that you have hit your max and you have not been able to take time off because you are being the hero for your unit, you now have until June 30th to take that time off. But I will always and continue to always strongly encourage you to take vacation time because it's much needed to refresh your mind and your body as we keep going on this long haul on these efforts. Please remember to visit the Blink for the return to campus guidelines and resources, including the return to campus checklist, the flexible work arrangement, documentation and guidelines, and policy, and training and professional development. We are offering additional trainings for those managers and supervisors who weren't able to attend our return to campus trainings earlier in the summer. So we'll have another couple sessions for you to attend. As everyone is planning to ramp up their return to onsite, please make sure you're including your temporary employees in your communications as they are working within your unit and will be supporting your unit, whether that is resuming onsite efforts or whatever the hybrid or remote work arrangements are in place. But make sure you are communicating with your temporary employees. Next slide. As it relates to the vaccine mandate and to supplement what Angela shared, a lot of what we see between our vaccinated numbers and our actual compliance with the policy is individuals not realizing the difference between that upper picture that they haven't quite done the consent and the lower picture showing that they have completed the consent. A number of folks think they have the message, they clicked on the message, so they should be good to go. They're not done. They have to click on the header of that message, click on one of the words, consent to share COVID vaccine information. Click on one of those words, it will take you to a different screen where you can actually review the consent, say, yes, you approve, and then hit submit. There is a couple of clicks, a total of 3. It's not that difficult, but they do have to make sure they do those clicks in order for it to turn green to share their vaccine information. And that we found out in a lot of the one-on-one conversations with staff who and academics who feel like they're done, they realize they haven't actually concluded that process. So if you can double check, if you've been getting what some of you probably are quite annoyed by some of the communications by some of us about you still are showing not complying, you're like, I've done all the things, you may not have quite done all the things. And please know, our intent behind all of these additional communications is to just get everyone in compliance. We don't want to engage in any form of disciplinary action of anyone. The goal is compliance. That's what we would like to do. So we will just continue with the nudging on the front end so that you don't end up with the negative documentation on the back end. Please also know, those of you who have Sedgwick pending exemptions or deferrals, you need to follow the instructions on the emails that they've sent you. A lot of people are taking the Sedgwick information and then they're sending a whole new email with a new subject line and no information about their file. And so Sedgwick is not able to reconcile those as quickly as they would with everyone else. So you're still showing as if you haven't engaged with Sedgwick on the process, and that's going to cause trouble if you don't follow their instructions. So please reply to their email, follow their instructions, and then we can get your exemption or deferral processed. The supervisor dashboard, please, supervisors, check that dashboard daily. We have been sending a lot of communication centrally, but it is still on you to really work with your employees as you see their status, because some of that is at what Angela referred to earlier. Some of them may not have been testing in accordance with their exemption or deferral, or while their exemption or deferral is pending. So we will help you with template language to communicate with those employees, but you need to do so that they know that there's an additional step they need to take for the testing to be in compliance with the testing policy. And with that, I will turn it back over to Bob.
Well, thank you, Dr. Sosha and Senior Director Winbush. Now we'll move on and hear from Dr. Allison Satterland, Vice Chancellor for Student Affairs, about move-in and student compliance with masking and COVID protocols.
Thank you so much, Dr. Continetti. Good afternoon, everybody. So you've heard from EVC Simmons and Dr. Schooley and Dr. Sosha about the incredible campus collaboration with hundreds of colleagues, our students and their loved ones, that culminated in a safer fall move-in just last week. We now are delighted to have 12,124 undergraduate students moved in safely. We're also very fortunate to be able to report that we have 13 student positives that were reported following the move-in testing protocols. And if you think about that, just thousands of students and our partners on campus working together to ensure that low level of student positivity, it really is because everybody has been so dedicated to the compliance protocols that I want to just quickly outline how to ensure the compliance with those protocols and invite your partnership in helping us do so. So as a reminder, when we were working together with our public health faculty last year to build the values and the paradigm that really inform our approach to compliance, they advised us to really think about student conduct and student compliance in this space from a public health perspective, thinking about public health research. And so that meant relying on peer education, removing barriers to public health practices and resources, celebrating that compliance, and moving to progressive discipline when there was intentional noncompliance that put others in harm's way. And so we've continued to apply that strategy as we move into this new academic year as well. And for those of you that are on campus in person, teaching and working, you do see the students masking outdoors and maintaining physical distancing and actively engaging in friendly compliance with one another. But we also know that there are students who are still testing some of the limits and making sure that we are serious about our commitment to public health, or who just are not aware of the expectations in this regard. So if you see concerning behavior, please know that there are a couple different ways that you can report that. The easiest way is to send an email with the who, what, where, and when, at least the what, where, and when, if you don't know the who, to studentconduct@ucsd.edu. You can also report incidents to the Office of Student Conduct. We have a reporting form that's available on the Office of Student Conduct website that's also linked to our Return to Learn page, as well as the Vice Chancellor Student Affairs Office page. We have a resource page that's been developed by the Office of Student Conduct, which has information and suggestions and guidance for handling a non-compliance in the classroom or lab setting or in a student-facing support service space. And if you have just a desire to have a personal consultation, please email vcsa@ucsd.edu and we'll set up some time to talk through about the circumstances that have you concerned. I also wanted to share that our Associated Students Body President, Manu Agni, and our Graduate Professional and Student Association President, Brian Lattimore, developed 2 brief videos that can be shared in classes and labs and student-facing offices to remind students how to care for one another and themselves by being in compliance with indoor masking. And these videos are available on the RTL site for your use as well. They can just be a friendly reminder for you to play in advance of class or on a team training or orientation with your students and graduate students, instructors, et cetera. So again, we're available to you for consultation. We encourage you to check out the resources that have been developed to support compliance, and just that this is our work together, and we really appreciate your compassion and grace and to our students during this challenging but exciting time for them. So now I'm going to turn it back over to you, Dr. Continetti. Thank you for the opportunity.
Thank you, Vice Chancellor Satterland. Next, we're going to hear about fall instruction from Dr. Carlos Jensen, Associate Vice Chancellor for Educational Innovation. Carlos.
All right, thank you, Dr. Continetti, and thank you all for having me and giving an update on fall instruction. So first of all, welcome to fall term, and thank you for all the hard work that's gone into preparing and planning for a return to predominantly in-person instruction for this fall term. I'm going to share with you some numbers. These are preliminary numbers. You all know that until the end of week 2, none of these are official, but we have over 41,000 students currently enrolled, and the numbers look very, very healthy. Instruction is predominantly in person as we planned. Less than 25% of our total course offerings are offered remotely, with the vast majority in person. We have about 900 or so undergraduate students who are doing a fully remote course load, and these are students who we've worked quite extensively with to make sure that they had an accommodation and they had a path forward. And thank you all for your flexibility and willingness to support these students. But as we can see, the vast majority of our students are doing a mostly in-person course load with maybe 1 or 2 courses that they're doing remotely. And I just wanted to share this picture on this slide to show you all the joy of seeing a classroom full of students again. This is one of our outdoor classrooms. Next. In getting ready for fall, many of you have already been in the classroom, but if you have not, Educational Technology Services has worked very diligently to do some fairly major upgrades. We've upgraded Zoom capability with auto tracking cameras in the vast majority of our spaces, and we'll continue to work diligently until we hit all the classroom spaces. Microphones are available for delivery for free in the rooms that have lapel microphone systems, and all you have to do is request one. ETS has done extensive tests with voice projection and clarity, teaching while masking. That's been one of the big concerns for faculty. And there's some video examples off of the Educational Technology website that show how a student in the back of a room will hear your lecture with and without a microphone. And in all cases, the sound sounds better than what you would have imagined. Educational Technology and the Teaching and Learning Commons have updated their websites now with new support, advice, and resources, especially best practices. So please check those out. And then our friends for Educational Technology Services are expanding on-demand ways of getting in touch if you need any kind of support. So everything from phone to email. You can request an in-person consultation, virtual office hours and appointments, and even text messaging. So they're here to help. And with that, I'll turn it back over to you, Dr. Continetti.
Thank you, ABC Jensen. Now I'm going to turn it over to Senior Associate Vice Chancellor for Research, Miroslav Krstić, to take us through updates concerning our research activities. Miroslav.
Thank you, Senior ABC Continetti. This campus has remained a research powerhouse through COVID, and I thank you all, from PIs to students to financial staff to everyone. So I have a few quick updates from the research affairs. Next slide, please. The basic stuff first. In the 2 middle buttons, the vaccine mandate by the UC system remains in force for everybody, and the masks must be worn inside. The research ramp-up plans also remain important. And please, if you have a new researcher coming to your lab, somebody has graduated, in most cases, please do send an email to researchrampup@ucsd.edu with the name of that person arriving or departing, their email address, and their role. Regarding, going to the last bullet here, regarding the graduate students in training rotation, the PIs do not need to be adding those students to ramp-up plans. We are receiving that information from the departments. Next slide, please. This is an extremely busy slide regarding human subject research. If one does have the time, the slide is useful. On the left, if you're a researcher or a staff member conducting human subject research, you will find the details of information that pertains to you. And if you're a participant, namely if you're a subject in human research, the information for you is on the left. But to summarize, the masking requirement applies to all. The symptom screening applies to all as well. The vaccination requirement applies to the researchers and staff, but not to research subjects for whom it is only recommended. The distancing is not restricted among the researchers who are wearing masks, so they can be close to one another, but the human subjects should maintain a 6-foot distance relative to the researchers. And if the nature of research requires a deviation from that, then the PIs should work with the EH&S to develop an alternative risk mitigation plan, and that should be attached to the research ramp-up materials. For clinical research, the health system limits the number of researchers in the patient room to 2. Next slide, please. Dr. Sosha already mentioned the Can Notify app. This is something that is not required, but it is strongly recommended to those participating in on-site research. What I would like to add regarding that app is here is the address is cannotify.can.gov. And it is extremely quick to activate this on your mobile device. If you have an iPhone, it just shouldn't take you more than a minute to do this. Just go into settings, scroll down to exposure notifications, and click turn on, and you're done. If you're an Android user, you have to download an app, and it might take 2 minutes. So that is all from me, and I would like to hand it over to Michael Korn, the Chief Information Security Officer.
Thank you, Miroslav. First of all, thank you everybody for making time. I'll be fairly quick here. You may be wondering why we're talking about cybersecurity in the middle of all this conversation about vaccines and safety protocols. The reality is that from a cyber perspective, we've been under a pandemic for years. We see thousands of attacks against the campus every hour. And we also know that research is being targeted very extensively and directly by hackers, particularly state governments. So working with the VCR's office, we've put together the Cybersecurity Certification for Research program. We know that faculty are already burdened with enormous numbers of compliance and administrative tasks. So we've put together a program to establish basic security controls in each research environment. Controls that work very much like vaccines and CA Notify. We've also, as part of the program, want to collect a little more information about your research so that we in the security office can target our mitigations to protect you and to alert you when something goes wrong. And as part of the program, we will be providing detailed recommendations for those labs that engage in higher risk activities and following up with you for some additional activity if necessary. But the key thing here is we really want this program to help UC San Diego researchers become more competitive than they already are. And the reason we want to do that, go on to the next slide, please, is because all of the federal agencies are now revisiting the cybersecurity requirements they build into contracts and grants. We're seeing now, for example, data use agreements, data sharing agreements that are including very aggressive cybersecurity requirements. And over the next few years, this is going to continue to grow. So what the program is largely a self-assessment program. We've identified the minimum number of what we feel are very high impact activities. For example, we ask you to install the campus provided anti-malware software and some additional pieces of software, not everywhere, but where it can be easily supported. And all of this will allow us to better leverage the investments we've made in cybersecurity to protect your labs. Currently, we have almost $200 million worth of sponsored research that has received their certification and gone through the program. And it really is a very quick program to go through. If you email ccr-support@ucsd.edu, someone will answer your questions, provide assistance. We can even help with having software installed. Go to the next slide, please. So 2 things to point out. If you're curious about the program, we know you're very busy right now. This isn't a great time of year to worry about these things. Later in October on the 20th, as part of the Research Compliance and Integrity Office's Hot Topics program, we'll be doing a workshop. We'll be working right through the certification process. If you vet some of the information that you need to collect in advance, you can actually get your certification live during that program. We have a couple of milestones I want to point out. We are in the process of pushing the data from the CCR program into quality research. We're going to probably wrap that up around November. And sometime in the first quarter of 2022, we'll start feathering in the requirement to be certified for contracts and grants to do award processing. So this is coming. I would suggest it's really not that difficult, and try to get started on it sooner than later. And with that, I will turn it over to Assistant Vice Chancellor Ross Damon.
Hi, good afternoon. Thank you, Mike. I just have one quick slide. We've been sharing this information at the last couple of town halls, and I just wanted to remind the research community about the importance of what we call the 14.5.2 proposal submission guidelines. The proposal timelines were established to help manage some of our operational challenges and to address proposals that were received at the last minute. Department research administrators and sponsor project offices are stretched thin with increasing number of proposals and changes in sponsor requirements. The 14.5.2 will really help to ensure that departments receive the appropriate review of their proposals and submit it on time. So what do you need to know? The most important thing you can do at this time is work with your department research administrator to notify them of your intent to submit a proposal, and to have the research administrator create the proposal in the quality research system 14 days before the deadline. So that means working with your department research administrator well ahead of time so they have the necessary information to create the quality record. Secondly, route the quality record to the sponsored projects office with the required documents to ensure that we're able to review it. Our office will not review the proposal unless it's been routed in the quality system. Please remember to have the following documents when you route the quality record: the sponsored proposal guidelines, applicable face page, detailed budget. You can use the internal budget if a detailed budget is not required by the sponsor, and all other proposal requirements, PI exception, cost sharing, biosketch, and other supporting documents. The scope of work, the research plan, and outgoing subrecipient package, if applicable, only needs to be in draft. However, 2 days prior to the deadline, we ask that you provide the final draft of the research plan to the sponsored project office. Again, the 14.5.2 focuses on these KPIs to help address these challenges. Departments can view at any time to see how they are performing against these indicators, the 14 and the 5-day. And we can put that link in the chat if it's not already there. The goal for each of these departments is to achieve 100% compliance against these indicators. If you have any trouble accessing this information, please let me know. Currently, the rates for the 14 and 5 are 32% and 37%. These numbers have gone up significantly from last year when they were only 12 and 5% respectively. So we really appreciate all your effort that you've made to help ensure UC San Diego's commitment to the highest ethical and legal standards, as well as maintaining a top 10 research institution. And over the next year, we'll be working with your department to help achieve these goals. If you have any questions or concerns, please contact me. And that's it for me. And now I'm pleased to introduce our next guest speaker who's new to UC San Diego, our Executive Director for Federal Government and Research Relations, Natalie Albert. Natalie joins us after spending 6 years leading UC San Francisco's Federal Government Relations Program and assumes the position formerly held by Angela Phillip Diaz. So greet me in welcoming her. Thank you. And Natalie, I'll turn this over to you.
Great. Thank you so much, Ross. Hi, everyone. I'm Natalie Albert, and hopefully many of you have had the good fortune of working with my predecessor, Angela Phillips Diaz. You know, I can only aspire to have the same level of impact that she had on federal research funding and policy while she was at UC San Diego. So in this position, I am UC San Diego's liaison to the federal government, and it's my job to advocate for policies and advance and support the university's mission and values. So that means working to increase investments in research, promoting UC San Diego's contributions to healthcare and innovation, and serving as a resource to both policymakers in DC, but also as a resource to clinicians, faculty, students, and staff on campus. So it's a very exciting time to be advocating for science in DC right now. The Biden administration and Congress appear to be committed to making significant investments in research funding in FY22. We'll see how it all goes. There's a few details to work out this week to see if it all happens as they plan. But hopefully the Build Back Better FY22 reconciliation bill, which includes big investments in research, will be passing this week or at some point in the near future. And if you look at the slide, there's a huge $11 billion increase to NSF funding. There's a new agency proposed within NIH called ARPA-H. That's $3 billion investment. There's a big investment in Department of Energy, NOAA, NASA. So it's really great news if it can get passed. Separately, since Congress has yet to pass their annual appropriations bills, there's the threat of a government shutdown that would start on Friday. We're really hopeful that that will be resolved as well. I do want to note that the House has actually passed their appropriations bills. They're just waiting on the Senate to act. And the Senate bill, or the House bills, I'm sorry, which also have large increases to federal research agencies. And just another note to make things more interesting, Congress also needs to raise the debt limit in the next couple of weeks, and Republicans are resistant to that. So we're going to have a lot to monitor in DC over the next few weeks. And it's not really clear how things are going to play out. So stay tuned and know that we in the UC San Diego Federal Relations Office are closely monitoring this. And we'll continue to advocate for research policy. And I'll just wrap up by saying that we can't do this work without you. So we need people like you to help promote UC San Diego's mission at the federal level. So actually, next slide, please. Please feel free to reach out to the federal relations team. Our contact information is here. I work with Larissa Yuson, who's a legislative analyst, and you can reach out to either of us if you're interested in being an advocate or need assistance with the federal government. And with that, I will turn it back over to Senior AVC Continetti. Thanks.
Thank you, Natalie, and thank all of you for those important research updates. So now we've come to the question and answer segment for this town hall. We're running a little bit behind, but I do believe we have some time for a few questions. And so I invite all of our panelists to turn on their video. During registration, attendees had an opportunity to submit questions for the panelists to answer. And we have selected some of the most popular questions for the panel today. And obviously a number of questions have been coming in the Q&A window during the meeting as well and have been answered. Due to time limitations, we're obviously not going to be able to get to all of your questions, but we will do our best to post answers in the FAQ at the returntolearn.ucsd.edu website. So to start us off, the first question is for ABC Jensen. And the question is, what steps can an instructor take to minimize COVID transmission in an indoor classroom, large or small?
Thank you for that question. There's actually quite a lot that you can do. And I would emphasize two specific points. The first is model and promote safe behaviors. Remind students and colleagues about what the expectations are for things like masking, drinking, eating, etc. If you have a seating chart that you use for your class, make sure that you share that with the students so that if there's contact tracing that needs to happen, that the contact tracing team has access to that. The second thing, and perhaps more importantly, is think about how you structure your course and whether you're setting students up for making the right decisions. Specifically, do you make it easy for students to miss a class? If they're feeling under the weather or they need to go get tested or things like that. Our students are great at following rules, but we also know that they care very, very deeply about their grades and that they quite often feel a tremendous amount of pressure. So do anything that you can to make it okay, to normalize the kind of behavior that we want to see. That if you're not feeling well, if you're experiencing any symptoms, don't come to class, go get tested, and then resume your life. So how can you do that? Record or broadcast your lectures where possible, share your course materials, and then if the student approaches you and says, you know, I can't come in today because I need to go get tested or I'm not feeling well, be understanding, try to work with them as much as possible.
Thank you, Dr. Jensen. Next question is for Dr. Schooley. Given the campus COVID-19 policy and the high rate of compliance, do we expect to achieve herd immunity on campus? And how might this be impacted by new variants?
Herd immunity with COVID is a bit of a different animal because people who have previously been infected or who have been vaccinated see waning immunity over time. So we all become candidates for breakthrough infections or reinfection as time passes on. So we'll continue to have breakthrough infections in the vaccinated population. And we'll also have a number of people who've chosen not to be vaccinated who will continue to be picked off by the vaccine. So I don't think we're going to use an overworked phrase, get to zero, just because we have 90% of the population vaccinated. This is the boosters, I believe, will decrease the rate of breakthrough infections and will protect those further who get vaccinated. But I think this is a vaccine, this is a virus that's going to be with us for years to come, smoldering and causing trouble for, particularly for people who have underlying conditions who haven't been vaccinated or who are elderly. So I encourage all of you to pay attention to the booster timing and to line up for it. And those of you who haven't been vaccinated yet, all I can say is, as I said earlier, 46 of the 54 people in the hospital are unvaccinated, and every one of them who's on a ventilator is unvaccinated.
Well, that's a sobering message, but thank you. Next, we're going to take a live question from the Q&A for Director Kavanaugh. Will the Hillcrest shuttle bus continue to operate after the trolley is running?
Yes, but not in its current form. The Hillcrest shuttle is really duplicative with the Blue Line trolley, and the trolley has the advantage of not getting stuck in traffic, which unfortunately happens to the Hillcrest shuttle all the time. So we talked about the campus transformation, and the La Jolla campus isn't the only campus being transformed. We're about to begin a lot of construction over in Hillcrest in late November. And so on November 21st, when the Blue Line opens, we'll be taking all of those bus resources that were previously going back and forth between La Jolla and Hillcrest and concentrating them between the Old Town Transit Center and the Hillcrest campus. What that means is we're going to be able to have a bus meet every trolley coming from La Jolla in Hillcrest and go on up to the Hillcrest campus, providing a level of service that folks working in Hillcrest have never had before, and a level of connectivity between the two campuses that we've never had before. And I hear some of you out there thinking, but wait a minute, it's going to cost me to ride the trolley. It's not, at least not for now, because we are incentivizing folks to get on transit and specifically to get on the trolley as it opens. Your first 3 months of riding MTS bus and trolley service can be sponsored through transportation services, and there's a gradual step down after that of that support. And so sign up for your FastPass online now, and we will get you enrolled.
All right, that's good news. We only have time for one more question today, and this one is for EVC Simmons. EVC Simmons, do you have a sense of what the instructional plan for winter quarter will look like? And what about spring?
Oh, thanks for that question, Bob. This is, of course, on everybody's mind as we're working our way into the fall quarter. And I anticipate that for winter, especially with the advent of vaccines for younger populations that Dr. Schooley told us that is likely to come, and for the advent of boosters for those of us who are maybe a little older, that I'm anticipating that we really will be returning to our normal mode of in-person instruction for winter, for spring and beyond. Of course, making sure that we act flexibly to support individual students and do our very best to educate everybody.
Thank you. Thank you, EVC Simmons. So I'm afraid that is all the time we have for today. I want to thank everyone for their questions. Reiterate that we're going to do our best to answer everyone's questions by updating the FAQ that is on the Return to Learn website, posting a recording of this town hall as well. So I'd like to thank the presenters and guests today for sharing their time and information. And thank you, the faculty and researchers of UC San Diego, for attending today and working together as a community to help bring us through these unprecedented times. Today, we had more than 435 attendees, and these town halls are an important part of how we stay united as a community. To help improve them, we encourage you to complete the post-event survey that you will be sent shortly to help us continue to refine our communications during this stressful period. The next Return to Learn Town Hall for staff will be on September 28th, and for events will be on October 5th. Please use the Return to Learn website to register for these. Thank you.